Hello and welcome to Eyes on Research, the podcast that digests the latest scientific innovations in eye research using simple and understandable terms. I am your host, Thales Guimaraes, medical doctor and clinician scientist at Moorfields Eye Hospital. Hello and welcome to another episode of Eyes on Research. I hope you're having a great week so far. In today's episode, we'll be talking about refractive errors and why is it that most people will require glasses at some point in their lives. We'll first talk about how we see things, define and classify the refractive errors, and then we'll talk about the risk factors, symptoms, and currently available treatments. And in our previous episodes, we have talked about quite complex themes, right? We spoke about stem cell, gene therapy, inherited retinal diseases, amongst others. For a change, then, we'll talk about something that's much more familiar to all of us. We know the physics of these refractive errors for a long time now. So, the eye is an optic system and a great one for that matter. The way that we see things is by light coming inside our eyes and passing through a quite sophisticated machinery. In fact, the human eye is a type of eye that resembles a pinhole camera, albeit a much more complex one, with light coming in, passing a pinhole, and getting refracted onto the retina. So, light first touches the tear film on the surface of the eye and goes through the cornea, which is the most anterior segment of the eye and is responsible for approximately two-thirds of the total refractive power of the eye. Light then traverses a liquid named aqueous humor, passing afterwards through a pinhole that adjusts to the environmental light, the amount of environmental light, intensity of environmental light, named pupil. Afterwards, it gets further refracted by the lens that we have inside our eyes, named crystalline lens, with the rays of light then passing the intermediate section of the eye, which is occupied by a transparent gel like structure that we call vitreous humor, then hitting the retina. Now, the retina is a film like tissue composed of many millions of light sensitive cells, which are cells that react to light, and we give them the name as photoreceptor. And when these are hit by the photons of light, a complex cascade of events takes place, which ends up with electrical activity being sent to the brain via the optic nerve. In a nutshell, and very simplistically, this is how we see. Now that this is well understood, and this was a basic concept that we had to talk, it becomes easier to define these errors. By definition, refractive errors are a problem when the light is not focusing as it should in the retina, on the retina. It is the most common type of vision problem that someone can have, and the estimates are that it affects around 1 to 2 billion people worldwide. I'll just say this to get this out of the way. Refractive errors are, in most cases, not a disease. Indeed, in most cases, refractive errors are more like a misalignment between the refractive power of the eye and the size of the eye. And I say this because very frequently there is what we call an axial component to refractive errors, meaning that the eyes may grow too long or too small for the refractive power of the eye of this optic system, right? This translates to the image either forming before or after the retina, resulting in all the symptoms that we have when you have refractive errors. And each type of refractive error is different, but they all make it hard to see clearly. This is what they all have in common. But what are the most common types of refractive errors? Well, we have myopia, hyperopia, astigmatism, and presbyopia. And let's talk about each of those separately now. Firstly, we have short sightedness, or nearsightedness, or myopia. These are terms that mean the same thing. And as the name suggests, people with myopia can typically read and do things related to near vision really well. That's why we call them short sighted. This is because the image forms before the retina. Essentially, the refractive power of the eye is too strong for its length, or the eye is too long for its refractive power. The main symptoms of myopia are blurry vision when looking at distant objects, and the way we treat this is to try to reduce the convergence of the light rays onto the retina. And we do this by creating a divergence of these rays with concave lenses. So when you see those numbers on your prescription after you left your eye care provider, your optician, your optometrist, your ophthalmologist, it doesn't matter who it is, but after you leave with your prescription, you see that if you are short sighted, you see a negative value in the spherical power of the lens. So something like, let's say, -3. The minus here indicates that this is a concave lens, and the 3 indicates the diopter power of the lens. Now, I just want to say that patients with high myopia may be at risk to other stuff. And we usually say high myopia is when you have 6 or more diopters on your glasses. These patients may be at a higher risk of having degenerations or areas of fragility in the more peripheral part, the more peripheral sections of the retina, which frequently need observation and sometimes even lasers. The reason being that these things may increase the risk of having retina detachment. So it's very important to go to your doctor and do regular examinations of your retina with dilated pupils. Also, new floaters, flashes of light, but particularly sudden vision loss should trigger you to go immediately to an eye A&E unit. The second type of refractive error is hyperopia or farsightedness, which is when the refractive power is too weak for the size or the length of the eyes. Or you could say also that the eye is too short for its total refractive power. In a lot of ways, this is the opposite of myopia, of short sightedness, right? People with hyperopia have blurry vision when looking at near objects because the optic system of the eye is not able to focus the light enough for it to form on the retina. And you correct this by increasing the convergency of the beams of light. So you want to do that with convex lenses. And the prescription should have a positive spherical value. The third type of refractive error is astigmatism. And this one is a bit different. It doesn't usually have to do with the size of the eyes so much as it does with the cornea. So remember that the light coming towards our eyes first hits the cornea, which is a dome shaped structure. If the refractive power is not uniform or the curvature of the cornea is unusual, there will be distortion of the image because the light will be focused more strongly in one direction as compared to the other. Now, people most frequently have isolated astigmatism without any other condition, but high astigmatism, particularly when asymmetric and increasing swiftly, may be due to the cornea being shaped in an unusual way, such as when it's shaped as a cone. We call this keratoconus, and we have a full episode on keratoconus just released 2 weeks ago, so go check it out as we talk about this a little bit more in detail. Essentially, it's when the anterior part of your eye, the cornea, this dome shaped window that we have, is shaped as a cone, as the name suggests, right? Keratoconus. Conus being a cone and kerato being cornea. And we correct astigmatism in general with cylindrical lenses, which represents the difference in the greatest and the weakest power of the eye. Lastly, we have presbyopia, also known as old age hyperopia. Now, I didn't really like this term. I didn't come up with this term in first place. But I have heard people calling it that. So yeah, This happens with age as the crystalline lens inside our eyes begins to lose its flexibility. So your lens gets harder and less flexible with time. And it's hard to adjust to objects, particularly when you bring them close to your face. That will happen to everyone at a certain age. Patients typically have difficulties to read or use the computers or anything really relating to near vision. And this is easily corrected with reading, bifocal, or progressive lenses. And what you would see in your prescription is a positive spherical power, again, just as hyperopia, or an addition to your normal prescription in case you are wearing bifocal lenses. Now, let's talk quickly about the risk factors. You may have seen that things like short sightedness or hyperopia run in families, right? So there seems indeed that there is some sort of genetic influence for this trait. Many genes have been identified as causative for familial myopia, and also many other types of genetic diseases, such as inherited retinal diseases, which are genetic conditions that affect the retina of some people, are also associated with refractive errors, right? So you may be a little bit, you may have high hyperopia or you may have high myopia as a consequence of that. Moreover, other multisystemic diseases, meaning conditions that affect multiple parts of the body, they may also cause some of these refractive errors. A few that come to mind are the connective tissue group of disorders, right? Things like Marfan's and Stickler syndrome. Now, there is an environmental influence to this as well. We live in a myopia epidemic, with estimates suggesting that approximately 50% of the population will be short sighted by 2050, which is a huge number of people, right? We're talking about around 5 billion individuals having myopia. We do have a podcast episode on short sightedness, which was just released a few weeks ago. So go check it out as we discuss about myopic epidemic in detail. In summary, we know that looking or focusing on near objects for long periods of time are associated with short-sightedness, with myopia. This is crazy to the point where 80% of the population of some Asian countries is short-sighted. So, from time to time, go for a walk, but particularly take your kids with you to play as we ourselves used to do when we were kids. Now that we have talked about the risk factors, let's talk about the treatments, right? And treatments are quite effective for refractive errors in most cases, thankfully, right? Firstly, glasses are the most effective way of correcting refractive errors, and actually, I'll even say that it's the most cost effective way of treating refractive errors. And we have discussed the specific of spherical and cylindrical lenses in each of the refractive errors that we have just gone through. So let's move on to contact lenses. Now, contact lenses are interesting. That's because some people will swear by it, while others will say that they'll never put contact lenses, they'll never be able to put contact lenses on. Also, there are some limitations with the things that happen with contact lenses. So you need to take care of it properly to avoid infections, and it's not recommended to sleep on contact lenses. It's not safe as it may increase the risk of having an infection, particularly when you make a habit out of it. Indeed, contacts are not for everyone. There are, though, several types of contact lenses from soft all the way to rigid contact lenses. So, if you want to try out contacts, I always suggest to every patient that comes to me and asks, I suggest going to your eye care provider for contact lenses fitting and for better instructions on how to put it on, how to clean, how to store, and so on. There are also surgical procedures to reduce or even eliminate the need for glasses. And there are laser procedures known as, for instance, photorefractive keratectomy, which is PRK in short, And then also the laser in situ keratomiliosis, which is LASIK in short. You may have heard, if you wear glasses and you ever wanted to do laser surgery to remove the need to use the glasses, you may have heard of these terms. And these are different procedures, but extremely safe. These are done multiple times every single day in every side of the planet. So we are very used to doing that. So, yes, they are very safe. There are, though, some complications that can occur after laser surgery, so it's very important to talk to your doctor and ask about what these are before the procedure. And he will also be able to tell you if you are a good candidate or not for having laser surgery, right? And there are some things that are implicated in this. What is the thickness of the cornea? What is the prescription that you have? Do you have any other thing in the retina? Stuff like this. So, you'll be able to judge better. And it's a case by case scenario. There are also other types of treatments being explored for some specific types of refractive errors. For instance, there are plenty of trials trying to reduce the progression of myopia, including using drops to dilate the pupils. These are incredibly promising and are still being investigated, so keep posted as new research updates should come soon. And I should just say we post this in our blog page, which is linked in the description of this episode, which is also our support page. Speaking of which, we have a full article there on myopia, and that's on top of our podcast episode with sources to all of these things. So, go check it out. Thank you so much for listening to me today. I should also say that we have social media accounts where we post short videos about teams that did not go on to become a full episode. So visit us on at Eyes on Research on your favorite social media platforms: Twitter, TikTok, Instagram, LinkedIn. We have it all, so go look for us. Also, you'll find a link in the description of this episode to our Buy Me a Coffee website, which is the website that we post our articles. Now, please consider subscribing to us there. It is completely free, and we are using that platform as a blog, so you'll see new weekly posts about curiosities and trivia about vision and the eyes, as well as hot research updates on topics that did not go on to become a full episode. So please do consider subscribing. You need to click the three dots in the top right corner of the website, provide your email, and hit follow. I can guarantee that you won't receive any spam as I send the emails myself, so you can sleep well at night. Our mission here is making science more accessible to the population, so it is free and always will be. However, we are completely self funded as well. So if you have the means to, you can certainly donate in our Buy Me a Coffee website, but don't feel pushed if you don't have the means to. You get access to special posts, episode transcripts, and cool things like, for instance, suggesting themes for blog posts, short videos, or even full podcast episodes. So please consider checking that out by clicking the link in the description of this episode. And a huge shout out to our new member, Nancy. Thank you so much. Otherwise, you can also share this podcast widely amongst your friends and families, and make sure to give us a rating if we like the work that we do. This helps a lot as well. Thank you very much, and I'll see you in the next episode. Bye bye.